Hey, today we're going to be talking about ventilators. Ventilators are a life-saving intervention used to replace or assist breathing by moving air in and out of lungs for patients who are unable to or insufficiently breathing. Ventilators are electronically controlled for management of pressure and airflow and equipped with monitoring systems to supervise patient vitals and ventilator functions such as leakages or power failures. Patients may need ventilators due to stroke, collapsed lungs, lung diseases, or while they are in surgery under anesthesia or during their recovery period afterwards. Because ventilator failure can result in death, the devices are rigorously designed to not have any single points of failure, even including manual backups in cases of power failures. Ventilators can be categorized as either positive or negative pressure, as well as invasive and non-invasive. Invasive methods involve instruments being put inside the body, which can refer to tubing either through the nose or mouth or through the skin. Negative pressure ventilators, or NPVs, work by applying a negative pressure around the patient's torso, forcing the chest and lungs to expand and suck in air and oxygen. When the negative pressure around the torso is released, the chest will deflate, causing the lungs to exhale and dump CO2. Today, NPVs are quite rare, mostly been made obsolete by positive pressure ventilators, but the iron lung, for example, was an instrumental tool in treating patients during the polio pandemic of the early to mid 20th century. Positive pressure ventilators, or PPVs, involve an air reservoir with pressure greater than the lungs, which pushes the air from the reservoir into the patient's lungs using valves and tubing, and in non-invasive methods this will also involve a sealed face mask. The release of air is oscillated to allow the lungs to inhale and exhale.
Ventilators are majorly used for any patients having trouble breathing. They can be used during surgeries or for recovery after surgeries or along with anesthesia. Ventilators assist in conditions like COPD, in which, because of prolonged exposure to chemical irritants, bronchioles inflame, allowing mucus to build up. ARDS, where fluid buildup in air sacs restricting lungs from pulling enough air. Or when patient is suffering from brain injury or is in comatose state. It is also used for treating patients suffering from pneumonia. Apart from this, there are many other conditions in which ventilators help in quick recovery. Though ventilator is very useful for treating lung diseases, some complications may occur. For example, prolonged use may cause lung trauma, and it may become difficult for patient to wean off the life support system. Often patients on ventilator are given heavy medications which may have side effects. Ventilator-associated pneumonia is a common infection occurring in mechanically ventilated patients.
The ventilator recently became a household term as the world fell into a global pandemic. With COVID-19 affecting the respiratory system of those infected, ventilators quickly became extremely important. A study conducted by the World Health Organization at the end of February announced that 5 to 10% of patients critically infected would require the help of a ventilator. As Australians, we have been lucky. However, our friends in the US have not been as fortunate. With over 7.5 million cases since the outbreak and over 200,000 deaths, their need for ventilators has been far greater than ours. The New York Times reported in March that there were not going to be nearly enough ventilators in the hospitals to supply the onslaught of coronavirus cases. It was reported that the United States had roughly 160,000 devices at the time, which led the Trump administration to invest close to $3 billion in making 187,000 new devices. The importance of the ventilators was stressed by the governor of New York, stating that he may need as many as 30,000 of them. As well as this, the global ventilator market is predicted to multiply six-fold going into the next year, which is largely attributed to the outbreak. The recent need for ventilators has driven leading medical device manufacturing brands to immensely increase their production, such as Medtronic increasing by 40% and Philips fourfold. Dire circumstances have also required businesses such as these to team up with other leading brands to speed up production in this time of need. Ventilators have played a significant role in bringing the world together to tackle this global issue. Their use during the pandemic, as well as general use in the medical field, has changed the way surgeries are conducted, as well as the treatment and recovery of patients.